Shall we get going, Sophie?
Sure, yeah.
Welcome, everyone. This is the Water Program Team monthly water webinar series. I'm Ellen Bruno. I'm an assistant specialist in Ag and Resource Economics at UC Berkeley. And this seminar series is organized jointly with my colleague, Sophie Khan. The seminar is being recorded and will be available afterwards on YouTube. Please, as you have questions throughout the seminar, type them into the chat, and Colleen will, our speaker will answer them at the end. Safik and I will read off your questions for Colleen to answer at the end. Today we're delighted to have Dr. Colleen Naughton speaking today. She's an assistant professor in the Civil and Environmental Engineering Department at UC Merced. Her lab does research at the Food, Water, and Energy Nexus using life cycle analysis, geospatial analysis, and integrating across anthropology and engineering disciplines. And today she'll be presenting some work titled Water Health and Environmental Justice in California's Central Valley. So please take it away, Colleen. Thanks for coming.
Yeah, thank you, Ellen, for that introduction, and thank you both Ellen and Safik for having me today. Thanks to everyone for joining on a Friday afternoon. I really appreciate it, or listening later on YouTube. I hope everyone is healthy and safe during these difficult times. So I'll be presenting a geospatial analysis of water contamination and health disparities in California. And so I'll be covering two main topics, but heavily on geospatial analysis of nitrates and thyroid cancer, also on 1,2,3 trichloropropane, looking at some initial research there after a background and some conclusions and recommendations. The introduction, as Ellen already said, I'm an assistant professor in civil and environmental engineering at UC Merced. I'm now in my second year here. Before that, I was at the University of South Florida as a postdoc and graduate student. I served in the Peace Corps in Mali, West Africa as a water and sanitation engineer for 3 years. I also did a science and technology policy fellowship in Washington, DC. So I tried to make sure my research also connects to science policy. Just a little background on my lab. It's FUSE US, or Food, Energy, Water Systems for the Underserved, and for all of us in the United States and globally. I have a lot of international development experience over 10 years, much of it in West and North Africa, but I do focused in underserved communities, now doing more of a domestic focus. I strive for my research to be community-based participatory research. So definitely an opportunity here at UC Merced, given the mission of the university for research, teaching, and service. So it's been a real privilege to move here and to learn about the community and about California and the issues that the communities here face. And through our research, we co-design sustainable and culturally sensitive food, energy, water systems with communities. In the first year before the pandemic, I was going to a lot of community meetings and listening in and doing some education programs and activities in the community. That's a little bit on hold right now with the pandemic being all virtual and not wanting to overburden the communities right now with virtual surveys and such. I am doing some COVID-19 based research for the community. So we're doing a bit of geospatial analysis and modeling and what we can do with the literature, but hoping to get back into more of that active community research once this is all over. I couldn't do all this research without my students in the group. I think Ariana Tariki is here. She's pictured in the top right and did much of the research I'll talk about today. We're still active, even though all remote. I'm continuously inspired by the students at UC Merced and their intelligence and their commitment to the community and their passion. And so I usually give this overview. I won't really need it here for California and where UC Merced is in the Central Valley, and just being this agricultural powerhouse. And just the number of crops and just the economic productivity and how California has become one of the, if it's ranked among countries, like the sixth most, powerful, like producing state or country. But despite all this like wealth, there is some high disparities, high poverty rates, and even high food insecurity and air pollution, some of the worst in the United States. And so many of you are familiar with CalEnviroscreen. So this talk is similar. If you've been to Anhil's talk in the monthly series in November, I'd highly recommend if you haven't watched it on YouTube. So similarly references CalEnviroscreen and work with communities and highlights work in the community. It's a really great tool that is available in data sets. I'm used to much less data available in low-income countries. And even in the United States, working in Florida and Michigan, this data set is pretty powerful to not just show based on like income level and poverty, but overlaying different indicators of pollution, burden, and exposure, and population characteristics like low birth weight and asthma. And so those that kind of score the highest in these percentile or the worst are in as considered disadvantaged communities in the 25%. And so you see a lot of these are in the Central Valley lighting up there. I do like to, so everyone's on the same page, give the definition of environmental justice. It's in the title of my talk, but it's about the fair treatment and meaningful involvement of all people. So regardless of race, color, national origin, or income with respect to development, implementation, and enforcement of environmental laws, regulations, and policies. And this is specifically has become apparent given the events of this summer with the murder of George Floyd and just with the COVID-19 pandemic exposing these disparities that, in California, I think it's like 3 times as many Hispanics die of COVID than whites, and similarly high rates for Black people. And just the difference between, you have equality and you have equity, and you can't just give everyone the same product and expect them to succeed. We really need to make sure that we're designing our systems, our infrastructure for everyone from low income, minority, elderly, and children. I guess this connects with me. I'm 5'1", so a little short or fence graphic, but so for equity, we're helping for those more disadvantaged communities or people with disabilities overall. And just if you're advancing it to justice, you're removing the cause of the inequity in general or getting rid of that systemic barrier. So if we apply this to water, if we've had decades of contamination in our water sources, it's kind of hard to eliminate that overnight or what caused that in the first place. A lot of times we were applying chemicals that we didn't know had these health issues, and now we're kind of stuck with them, and then it's in lower population areas. And you'll often, unfortunately, hear the urban areas be like, well, why do we have to pay for rural areas for systems that are serving a smaller number of people? But these people and are especially in the Central Valley, are providing us with food and at low prices. And for these years has provided this service. So there's questions of equity and justice in those ways, and that we need to provide treatment and provide funding. So if that funding is not going to come from the price of your food, it potentially does have to come from tax dollars or support or other taxes to address this. Often in low-income countries, we talk about the Sustainable Development Goals or Millennium Development Goals. Sustainable Development Goals are 17 goals we need to achieve by 2030. And they were supposed to be more inclusive than the Millennium Development Goals, or focus on all countries. We don't see as much of the SDGs applied in the United States, but there's some. And so there's a lot of people that lack access to clean drinking water and sanitation and hygiene. And so by 2030, the SDG 6 aims to have universal and equitable access to safe water for all. And a lot of us have heard of the Flint water crisis. I'm originally from Michigan, so definitely hear about it a lot. But there's a lot of people that lack clean drinking water in California. There's estimates up to like 1 million children and adults in California lacking access to clean drinking water. So in a population of 39 million, this might not seem like a lot, but those are real people. And as we've seen with the deaths with COVID-19, these are real people, not just statistics that we need to address. So safe drinking water in California, this is a map showing the Safe Drinking Water Act violations. And again, we're seeing areas in the Central Valley at higher percent of the population impacted by unsafe drinking water. So depending, you'll see different statistics from the 1 million I showed to the 360,000. I believe even 1 million might be an underestimate. There's people that may have unsafe drinking water for just a period of time, especially during a drier season, but then have cleaner water the rest of the year. So it's definitely an issue in California. The Public Policy Institute of California and UC Davis have a lot of literature about nitrate loading in the Central Valley, and also levels with dairies and manure applications that have caused nitrate contamination in drinking water, and also other fertilizers and pesticides. An issue with drinking water in California isn't just about the quality of the water, but the quantity. We had that major drought, and people were their wells were running dry, and they were not connected to a municipal water system. So they had to get bottled water trucked in, and it was an issue you often only see in low-income countries, or think you only see, but is prevalent in the United States. There's also contamination that's just naturally occurring. There's naturally occurring nitrates, also arsenic and uranium in groundwater. And it's not just agriculture. There's like septic tanks and industrial contaminants that contaminate the water. So you kind of come with this like toxic soup of arsenic and nitrates and other chemicals in the water. But there is some good news. I don't mean to be all negative, but California is the only US state to recognize the human right to water. This was recognized by the United Nations in 2010 and recognized by a lot of other countries. And it was the human right to water and sanitation. So the California human right is focused on water mostly. But like many UN resolutions, the United States has not ratified it in the Senate. So individual states are taking action like California. So even though California recognized this in 2012 and we seem like we're still far from everyone having that right, it still provides like a legal mechanism to provide communities with clean drinking water. And just some of these disparities with the disadvantaged and like unincorporated communities, and looking at some of the racial differences, you see the percent of populations intersected by out of compliance community water systems, higher percent Hispanic than white populations, and even in incorporated communities, out of compliance is higher. There is another California law to SB 88 to connect disadvantaged communities to community water systems. Often these small communities can be right next to a community that has clean drinking water to their taps, and they're relying on these contaminated wells and systems. And so it is kind of slow moving. It was acted in 2015. I think only one community has triggered this system. It takes a while and it takes a lot of money to connect these systems, but it's important to do it. And so there's, even with the percent of population not intersected by community water systems, again, we're seeing these racial disparities with higher percent Hispanic. So I do the chat, it's harder for me to see during the time, but I'll have time for questions at the end. Okay, so for health inequities, these are the California health statistics, and you do see some disparities between American Indian, Alaskan Native, Black, Hispanic, and white. Not as many with Hispanic, but you do see percent almost triple for poor fair health percentage, but with Black populations, almost twice as much premature death years lost per 100,000, and higher percent double of low birth rate. So higher premature death rate for American Indian, Alaskan Native, and higher percent poor fair health. And just graphical, I know it might be hard to see, you can download the report, but as far as the length and quality of life in California, Blacks do rank among the worst by far, followed by American Indian, Alaska Native, then Hispanic and white. So from this, we often see health data presented solely, we see water data solely, but I really wanted to, in my research, look at health, water data together, as well as environmental justice and racial disparities in disadvantaged communities. So Ariana Tariki has been leading this project for a year and a half. We do have a publication under review with minor revisions in environmental engineering science, looking at nitrates, environmental justice, and thyroid cancer in California. So as you can see on the left, the different sources of nutrients I've talked about: agricultural, nitrogen-based fertilizers, as well as septic tanks and animal manure. Some of the research from UC Davis shows like a lot of the agricultural or the nutrient loading comes from agricultural sources. But in areas like LA and San Francisco, you can see a little bit more industrial sources. So why like nitrates and thyroid cancer? A lot of times you may have heard of blue baby syndrome associated with nitrates in groundwater. That's where we have a maximum contaminant level, or MCL, US EPA, as well as the World Health Organization. Well, World Health Organization has like 11.3 parts per million or milligrams per liter nitrates, nitrogen, and so the nitrates react in the blood to prevent oxygen flow in the blood and can create blue baby syndrome. But there's been recent literature linking with the link of thyroid cancer to high nitrates in the groundwater or drinking water. And so this has happened in Iowa and Vermont. Iowa surveyed about 20,000 people and found a correlation between those with contaminated drinking water with nitrates and thyroid cancer. Similar in Vermont, they found higher cases, higher thyroid cancer rates associated with environmental contaminants from like septic tanks, including nitrates. And so how nitrates cause thyroid cancer, the mechanism is thought that when you drink nitrates, it's different than eating them. There's actually a negative correlation with ingesting nitrates, say in vegetables or in like a lot of your processed foods. It breaks it down to the nitric acid. But for thyroid cancer, the compound does not break down the same, and it forms these nitroso and nitroso compounds that are highly carcinogenic. And so thyroid, just some background on California thyroid cancer statistics. It's about like a little over 12 per 100,000. Thyroid cancer in general for the world is like the fourth like leading cancer or most common cancer. And it's pretty high in the United States and California as well, projected to be the fourth most common cancer in 2030 in the US. And it does affect more women than men, unfortunately. And for the mortality rates, just looking at the different racial disparities, the cancer incidence rates are actually pretty similar, but there's higher mortality rates in Hispanics than in the general population. And mortality rates are about similar between men and women. But the good news is it's not really a high like mortality rate for the cancer. It doesn't mean we shouldn't care about it, since there's still like it affects your health and a lot of like increased healthcare costs, morbidity. Like anyone that's had maybe a cancer scare, had to get a biopsy. It's a really like stressful process and can be very expensive. So luckily it's pretty treatable, but the thyroid cancer rates have been increasing over time. Looks like we hopefully are getting to a plateau, but it's definitely a very common cancer. And so looking more at nitrates in relation to thyroid cancer in California, we didn't find any studies in the literature doing this, so we thought we could fill a gap and do a similar analysis like Vermont and Iowa. So we used ArcGIS Pro and the California Water Board's Gamma database. So that's the groundwater ambient monitoring and assessment program. So there's a lot of data in there since the 1900s. So we averaged the different well points for their concentrations of nitrogen. And we looked at it in relation to disadvantaged communities. So those are outlined in black on the right. And then the California Cancer Registry for 2014 used a bit of data from the California Open Data Portal. And I'll get more into the spatial statistics we used with the Gettys or GIS hotspot analysis and some regular statistical analysis with the non-parametric Spearman-Rowe correlation. Since our data wasn't normally distributed, we had to use a non-parametric statistic. So if you see the map on the right, this is just looking at nitrate concentration over the maximum contaminant level, which is 10. And you do see a bit like spatially of like a concentration in the Central Valley. There's a bit in Los Angeles, and you do see higher concentrations like over counties that have higher thyroid cancer incidences. It's not like really extremely apparent, but you do see some trends, and you do see a bit higher in disadvantaged communities. And so for the hotspot analysis, we use the spatial statistics tool, as I said, the Gettys or GI star. And so you input different parameters like a distance band and how many neighboring wells. So we used up to 8 neighboring wells, and it compares it to the normal distribution or probability with your current data set. So we're just looking at if the wells to determine the hotspots, you're just seeing if that's a cluster of areas that have higher nitrate concentrations than the average based on statistics. So we did 95 and 99% confidence interval. So you see a little less points here with the hotspots than with the regular over 10 ppm parts per million. And so again, you're seeing on the right, like more hotspots in the Central Valley and more overlaid with the disadvantaged communities. We do see a lot in Los Angeles area, some in San Francisco. So there is some industrial contamination there, and Los Angeles area did have a lot of agriculture before. So the 4 main results from this initial analysis with the open data did confirm some of the other studies we've saw in California with higher nitrate contamination in the Central Valley. So 39% of wells with nitrate contamination over 10 the MCL were in the Central Valley, and 40% of the hotspots. So the Central Valley only makes up 13% of California land area and 19% of the population. So this is higher than what they should be attributed to. And for disadvantaged communities, we also saw higher wells over 10 ppm and higher hotspots, so 38% and 42%. And disadvantaged communities only make up 14% of the land area and 24% of the population. We did find statistical significance with the Spearman-Rowe correlation between high nitrate well contamination per square mile and thyroid cancer incidence. And disadvantaged communities had 2 times the greater rate of thyroid cancer compared to non-disadvantaged communities. And looking at the statistical analysis, it wasn't like a home run as far as like all of the indicators having a statistical significance. We did have limitations on the data since we only had county level thyroid incidence, but we wanted to see what we could do with open data and see if there's enough of a there to then go through the process of getting public health data by census tract and everything. So we did see a correlation with the wells over 10 ppm per square mile, the hotspots per square mile, and the percent of wells per square mile over 10 ppm, and also over 5 ppm. There is an emerging, or has been a push to change the maximum contaminant level to 5 parts per million, but of course this would be very expensive. But we didn't see the association or correlation wells over 10 ppm per 100,000 people, or nitrate hotspots per 100,000. So this may have been because, well, some wells serve like million people or larger. So the wells per 10, like over 10 ppm per 100,000, especially in disadvantaged communities in urban areas. It's difficult to tease that out. We might need to go, it'd be a lot of data analysis to look at how many people is served per well, but that might be worth doing. And so some of the limitations with this data, and want to be very clear about that, is just, there's a lot of other confounding variables, other causes for thyroid cancer, like genetic disorders or like genetics in your family, as well as like other endocrine disruptors and other chemicals can cause thyroid cancer. So it's not just nitrates. People may be relying on bottled water, not drinking the tap water. They also have some drinking water treatment from their wells maybe, or at their household level. And health reporting, especially in disadvantaged communities, not everyone has health care, especially maybe undocumented people. And so there may be incidents of a thyroid cancer that's not getting reported to public health authorities, as well as their quality of healthcare might be lower, not detecting thyroid cancer. So some overall conclusions and recommendations: that there's maybe a potential association between thyroid cancer in disadvantaged communities in Central Valley in California with nitrate contamination in well water. And we do recommend, of course, even without this correlation, greater access to drinking water treatment and more incentives for nitrogen reduction on farms and wastewater and industrial sources. So it's not just, farmers or need to pay to treat the water because they're using fertilizer. I mean, they have real limitations with having to meet agricultural productivity goals and commodity prices, and competing against products from other states that don't have the same environmental regulations as California or other countries. So if they're not getting the money to limit the amount of nitrogen application or do more organic methods or more efficient methods, then that money needs to come from somewhere else to give them incentives to reduce the amount of nitrogen that they're applying to their land or their crops. And also, even if we stopped applying fertilizer right now, we'd still see, since it takes a while for the nitrogen to leach into the groundwater, we'd still see increases of nitrogen in the groundwater. So we still need treatment right now, even if, so we need a combination of both source reduction and drinking water treatment. Sorry, I need to get used to talking this long. I have 2 classes to teach starting next week, so it's been a while. And so for future research, we definitely want to get more of that granular health data to look into the census tracts in the disadvantaged communities, and also look into maybe thyroid disorders, not just cancer. And some of the disorders that lead to thyroid cancer. And also there's been links between nitrate contamination and other cancers like bladder, colon, and rectal cancers. So that's kind of the nitrate and thyroid research. I do have like a small portion on 123 TCP, and then we can get to questions. This is research is led by my graduate student, Hope Hauptman. And so if some of you may be familiar with 123 TCP, some may not. It was used in a soil fumigant in the 1940s on grapes, potatoes, other crops, but it was banned as this active ingredient. It wasn't like the main ingredient, actually, it's pretty small, but it was banned in 1984, but it still is very persistent in groundwater. It's been linked to human, it's a probable human carcinogen because it's been found cancerous in studies with rats and mice. And there's a maximum contaminant level for California, but not a federal maximum contaminant level by the EPA. There's also MCLs in Hawaii and New Jersey. And the California level is pretty low, 5 parts per trillion. I live in Turlock, and actually we're exceeding that a bit. And currently they just are on a 3-year plan to get us under the 5 parts per trillion. But you do see it again in the Central Valley. There's a map from the Gamma database, and you do see in LA and San Francisco. And so Hope did initially like a systematic review of the literature to look at the different treatment types and to get like a real good basis for what treatment technologies are out there and how effective they are. So this goes through different databases and keyword searches, so you don't just do a quick Google search or Google Scholar search. It's like making sure you aren't missing some of those key articles. So she analyzed like 36 studies that met the criteria. And we looked at the TCP contamination, like where it's been documented in different countries and in where the literature research was being conducted. You see a bit in the United States, Europe, Netherlands has a lot of TCP, and China, but you don't see any in Africa or South America. It's not necessarily because there's not TCP there, it just hasn't been tested for. And a lot of times when chemicals are banned in Europe or the US, they still have these chemicals and the companies sell them to countries that don't have those restrictions. So hopefully they can get some testing to see if this contaminant is elsewhere. And so here's the major treatment technologies. GAC, or granulated activated carbon, is the full-scale best available technology recommended by the EPA. It's okay in effectiveness. There's issues with GAC, and especially in the Central Valley of, replacing and disposing it. It can be expensive, and you have breakthrough relatively easy because of all the different contaminants you have in your water. But it is like cheaper relatively to other treatments and just what we have available. And so zero valent zinc is being used at pilot scale and showing some promising results in California. And the literature had a lot of like biotic studies or like microorganisms you can add to treat under anaerobic or aerobic microbes. But a lot of these aren't really at full scale yet, just kind of pilot scale. So there's some emerging treatment technologies that look promising, but so far, like GAC is the most popular, and also the type of granulated activated carbon in these studies is important, whether you use the common like Calgon carbon or there's coconut shell. Our group would like to look into using activated carbon from almond husks or hulls because we have a lot of those here. But it is important the type of GAC you use and also the type of water chemistry you have. If you have nitrates and others with the TCP, it might absorb other contaminants first and not be able to treat the TCP, or you might have breakthrough sooner. So some major conclusions, there's just a gap in global monitoring of 1,2,3 TCP in Africa and South America. Now we're trying to use GIS to estimate the amount of TCP that was applied using historical land use and pesticide records. We'd eventually like to get into some treatment methods. We'd like to look at, as I said, the almond hull or husk GAC, and also looking at household treatments like filters and how effective they are at eliminating TCP, because there's a lot of systems here, a lot of people that just have their kind of household well. And we need to see how effective those like reverse osmosis and other treatment systems are. And so overall conclusions between both the TCP and nitrates, there are large health and clean water disparities that exist in California. There's preliminary analysis through our research of potential association between nitrate well contamination and thyroid cancer. And hopefully I've sold you on maps, if you weren't sold already, that GIS can be used to analyze water contamination, health disparities, and environmental justice issues. I usually like to end on a positive note because I've been excited with the legislation that came out in 2019 with SB 200 about supporting and getting some funding for water treatment in disadvantaged communities in Central Valley and other places. There is a question now with COVID-19 of, with less tax money, tax base, with people being unemployed, the future of kind of this money, but hopefully after COVID-19, or we can start to build back better. I think COVID-19 has exposed a lot of these disparities that we have in the United States and in California, and that we can have better equity in California, especially with an access to basic human necessity like drinking water. So thank you for your time. I'll take any questions you have, but always feel free to email me, and thank you for this opportunity.
Thank you, Colleen. We have a number of questions in the chat here, so I'll just start. This goes back to towards the beginning of your talk when you're going through some of the nitrates and arsenic and other contaminants in the water throughout the state. Someone asks, how would added water storage improve all of these areas of nutrients in the water?
Yeah, so added water storage. Yeah, like, so, I mean, this would help. I think there's limitations in how much storage we're able to add. We've kind of dammed a lot of the rivers we have. I know there's potential with managed aquifer recharge and storage in different methods. So not seeing the context of the question, but yeah, I mean, more water would help. So to provide communities with more access to the clean surface water instead of the contaminated groundwater. I mean, of course, surface water can be contaminated by some of the runoff in agriculture as well, but from what I've seen with the California data and like the municipalities, the surface water is a bit less contaminated than the groundwater.
Yeah, my interpretation of that question, maybe that's wrong, is that I was thinking about managed aquifer recharge and how if we, sort of flood the water to infiltrate the groundwater, how does that affect the nitrates and stuff in the drinking water wells? Oh, so no, she meant more dam storage. So sorry about that misinterpretation.
Yeah, I know there's ways to raise the existing dams we have to increase the storage. So that could be helpful. But it's also like a lot of that water, surface water is going to like the more urban areas, San Francisco, LA areas. And I know there's been with the Sustainable Groundwater Management Act and with SB 200, like trying to increase the amount of surface water and whatnot that's available to these communities for cleaner drinking water, but that's always at the expense because we need the water for agriculture as well. So just trying to balance those different needs and also needs for ecosystems is going to be a challenge.
Thanks. So how were disadvantaged communities identified in GIS in the Central Valley, like a specific layer and data set? And maybe if you could even elaborate on sort of the definition of disadvantaged communities that creates that whatever layer or data set that you use to define them.
Yeah, it's defined, I showed by Callan Biro screen. So it's like the top 20, like fifth 25% of these different indicators. So you're just multiplying like the average of all these different burdens of all these different indicators and population statistics. So those with kind of the highest scores on those ends end up being classified as disadvantaged communities.
Okay, thank you. The next question is, within the county data set, I think referring to the thyroid cancer rates, would there be a way to identify whether someone is living within an incorporated city or not? Whether it'd be more likely to be on a public supply well that is regulated for nitrate MCL?
Yeah, there will be like, so we only looked at the groundwater data, but there are ways to look at, and it is a little bit more complicated analysis to just see where like you can look at the consumer confidence reports and where people are served by surface water systems and like their different sources, but I don't know if all that data is like in one place, so you'd have to kind of manually be looking, and they don't always provide the data sets for the boundaries of where those people are served. So even within city, like urban areas, there are people relying on groundwater.
Mhm. The next question, you had mentioned that Turlock had a plan for reducing TCP over the next 3 years. So someone's asking, what are some of the components of that plan to reduce?
Mm-hmm. Yeah, like it's not, I've been trying to dig for some of the details, especially since I lived here. It's not, I think they're going to be using a combination of like more the GAC or granulated activated carbon, but they're also just a lot of it is dilution is the solution to pollution. So they use wells that have less contamination and they mix the water, so you decrease the concentration of TCP in the water. So I think I think they said they're going to add some more public supply wells and mix the water a little better, but there's not too much information shared for their consumer confidence reports.
Thanks. So Kurt asks, are there other contaminants or perhaps behaviors that might be associated with or correlated with high nitrate levels in groundwater that might also be associated with high incidences of thyroid cancer?
Yeah, to see that one again. Are there other sources? Can you repeat the beginning?
Are there other contaminants or other behaviors that might be correlated with high nitrate levels in groundwater and also correlated with high incidences of thyroid cancer?
Yeah, I think so, Kurt. I think if you need to clarify your question, if I don't ask it, please do. It's always awkward with these Zoom type questions, but yeah, like there's, as I said, there's so correlated with.
I guess UC folks can speak up. There is no restriction.
Yeah.
Okay.
So,
Yeah. Do you mind if I clarify it a little bit?
go ahead.
Please.
Yeah. Just, I mean, so are there other contaminants that might be associated with higher levels of nitrogen, first of all, that might be the driver of the thyroid cancer rather than the nitrogen itself? Or are there behaviors that people may be engaging in those communities that rely on groundwater that has higher levels of nitrate? So for instance, maybe they smoke more. I mean, I'm just throwing out a kind of an arbitrary example. There's other, maybe there are other types of jobs or employment that they're exposed to might actually be driving the higher rates of thyroid. And it just so happens they happen to be around near domestic wells that don't have the type of treatment that public well systems have.
Yeah, thanks for that. Yeah, I mean, there's other causes for thyroid cancer. The health literature is still like investigating that. It's difficult to attribute just one single source to thyroid cancer, but they have found a pretty like solid mechanism, and other studies have supported it for nitrates in drinking water and aggravating thyroid cancer. But there are other just genetics as well as there like other endocrine disruptors, so other chemicals. So definitely, I guess, answer your question, there could be other factors, but usually it's just a lot of compounding factors because of these disadvantaged communities being in highly like environmentally contaminated areas, that it's just, maybe it's not just one thing, but it's a combination of things that are increasing. So whatever we can do to reduce these different environmental burdens will help.
Great, thanks a lot. I really enjoyed the presentation too. Thank you.
Yeah, you're welcome.
And Safik has a question too. Considering the overall increasing trend in nitrate levels, do you see any increase or decrease in health indicators over time?
Yeah, I mean, we do see like increase as we said, the thyroid cancer incidents have been increasing globally and in California. So definitely there's a lot of different health indicators that are kind of getting worse, but we are providing some better access and better treatment technologies that are helping. And Ariana, I don't, she's UC, so Ariana, if there's any questions that, since she was deep in the literature on the health literature and others, if you want to speak up, you can as well.
And if not, there's one more question in the chat for you too. Oh, now two more. But what might explain high nitrate levels in lower agricultural areas on the map? Outside of agriculture, where would high nitrate levels come from?
Yeah, like, so there's a bit like Superfund sites or just industrial areas could be reasons for high nitrate levels, and septic tanks. There's a lot of, especially in Northern California, I think there's a lot of usage of septic tanks, not as much wastewater treatment that might be contaminating it. In Florida, a lot of the nitrate contamination was from septic tanks and not from agriculture.
Okay. David, you want to unmute?
Colleen, it's just a personal question. It's just a personal question, and because I'm an RPCV from Niger. Do you know where Wallam is, and did you learn any Songhai or Zarma?
No, Bambara.
Bambara, okay, very good.
Yeah.
Anyway,
Yeah, that's
very
great.
much,
Yeah, I love.
very much
Go ahead.
appreciated your talk. Thank you.
Yeah, thanks. Oh, yeah, I love meeting other RPCVs. So, yeah.
Any other questions, folks? All right, well, feel free to follow up with Colleen over email. Thank you all so much for joining us today. It was a really great talk. Really appreciated you coming, Colleen, and thanks to everyone for attending.
Yeah, thank you. Thanks for having me. Have a great weekend, everyone.